Awareness Month, highlighting the challenges faced by premature and medically fragile newborns and their families. Mercy Medical Center's Birthplace is raising the bar with private, state-of-the-art NICU rooms designed to keep families together during some of those critical times. Here to share more about the initiative approach, Doctor, one more time on the last name. I had it and then I lost it again.
Ravi Sankar.
Dr. Ravi Sankar, a neonatologist with Mercy Pediatrics, and nurse practitioner Erin Burns, along with Mercy. Thank you guys for being here this morning.
Thank you.
Now, right off the bat, Doc had already asked, what's harder, prepare for a day in Mercy or preparing to be on live television? Which one's more nerve-wracking?
Definitely being on live television.
Well, let's get right to this because there's a lot to get to. First off, Erin, I'm going to start with you. Bringing attention to NICUs and all the work that you guys do, why is that important?
Well, I think babies are really one of our most valuable resources, and there's nothing better than to celebrate babies and all the things that they're able to do. So we're very fortunate that we're able to see all of those miracles happen. But Neonatal Month is really about celebrating other people who take care of them also. So today is actually Neonatal Nurses Day, September 15th. And then in order to remember the important lives of the patients that we take care of, September 26th is actually Neonatal Remembrance Day, where we think about the babies that we were unable to discharge from the hospital.
And Doctor, I want to turn attention to you. What is it about Mercy's neonatal intensive care unit that's different from other neonatal units around the area and around the Midwest?
Sure. So at Mercy, we offer what is called as the integrated model of neonatal ICU care. What's unique about this model of care is from the minute the babies are born, they continue to stay with their parents. They are not separated into a different location, unlike what happens in many other hospitals.
And we've got some video of those, some of those units we want to show you here too. Now we'll kind of take a look at that while you're talking about it, because the key is keeping everybody together.
And the reason keeping them together is it has a significant positive impact on the entire family, because this is an incredibly stressful experience for anybody who undergoes this.
Gotcha. Well, we kind of touched on that, is, you know, keeping the family together in one room. Erin and Doctor, I'll have you both kind of talk about this. Obviously, you've got that sense of, you know, community, but from a family unit as well, that's got to be just one of the main key factors of why it's important to have everyone together.
Correct. So research really shows that babies do the best when they're with their families. So we want to do everything that we can to prevent them from leaving them. So everything from doing procedures inside the room, and then we also have other visitors come and see them, like speech pathology. We can have different diagnostic testing done in the room. We also have occupational and physical therapy that come and see them, as well as something we're going to talk about in a minute, which is a therapist that can come see parents.
Yeah, well, before we get to that, Doctor, let's talk about some of the positive outcomes. I mean, we see it in kids that are going to school. Sometimes you don't even know that, hey, this child has spent the first months of their life in an intensive care unit. So talk about some of your perspective on that.
Sure. So I think in terms of the benefits or the positive outcomes, I would encourage people to think about it in 3 different domains. The first is, what is the benefit to the baby? The biggest benefit is the ability of the baby to heal and grow faster in the NICU in the presence of their mother and the family. And that translates to better ability to feed, and the more they breastfeed, they get all the benefits, therapeutic benefits of breast milk.
And for somebody, parents who might say, hey, this might be a possibility, you know, might be facing this road, what do you want them to know?
Sure. So at Mercy, we are a state-level designated level 2 neonatal ICU care. What that means is we can comfortably take care of any patients or any babies who are born as low as 32 weeks of gestation and anybody above 30 weeks of gestation. I think the critical thing I want to tell families is pregnancy is an enjoyable time, but also an incredibly stressful time. And when you look at the data, the chances of having a baby who's going to be born less than 32 weeks of gestation is incredibly rare. So in Iowa, we average about 40,000 births a year, and about a little more than 1% of the babies are the ones who are born as low as less than 32 weeks of gestation. So for the most of the families, our unit is extremely well equipped with the right skillful people who can provide dedicated care while they benefit from having the in-house and in-room NICU.
This is called the lightning round on Everyday Iowa. 2 questions to go. Erin, tell me about the Panda Project. You gave us a tease. Give me just a little bit of it.
Yes, so the Panda Project is something that was started in February, which is where we're able to kind of join a certified perinatal mental health counselor with any family in the NICU and anyone who has a history of a traumatic birth. So maternal mental health in the state of Iowa is really suffering, and so we wanted to do our part, and this is kind of how we're choosing to do that.
And if somebody wants to come see this beforehand, I mean, they want to check it out, what can we look forward to? Meet some of the people, maybe, because as Doc, you said, birth is a journey. It's not just a two-day thing where you're in and out of the hospital. Where can people learn more and set up an appointment to see this, too?
Yeah, so they can learn more by visiting mercycare.org/birthplace, and Angela would be happy to set up a tour at any time.
There you go. And there's the phone number, there's the email, there's the website. Thank you guys so much for being here today. Now, you said it's Nurse Day today, right?
It is,
Does that mean lunch gets provided for you today?
I don't know. We'll have to ask him, I guess.
Don't mean to put you on the spot, but I'm just saying the shining light is pretty bright now.
We'll have to celebrate our nurses, so we'll make sure that happens.
Thank you guys for coming in. More details on our station website. We're going to take a pause here. When we come back,